信心百倍地打好这一场阻击战、总体战，打好这一场人民战争。
In the run-up to the 2020 Spring Festival, problems caused by the new coronavirus were mounting in Hubei in central China. Across the country, desperate efforts were being made to halt the spread of the disease. Nowhere was the task more pressing than in the city of Wuhan. The whole country was mobilized to save lives. The entire population was recruited for the prevention and control effort. Everyone played their part in containing the epidemic.
新冠肺炎是恶魔，但是我们绝不能让它藏匿。在中国，我们要打一场人民战争。
The strongest line of defense would prove to be the people's unity. On January the 23rd, 2020, the early morning air was cold and damp in Wuhan. Zheng Lei, director of the police station at Wuhan Railway Station, arrived early for work. He was concerned about an order he'd received to enforce a citywide lockdown. This meant closing all transport routes out of Wuhan. Never in his 20-year career had he received such an order before. At 8 o'clock in the morning, across the city, 1,800 police personnel from the Wuhan Public Security Bureau reported for duty. They were supported by 300 officers and soldiers from the Provincial Armed Police Corps, along with the railway police at Wuhan's 3 major stations. Until the lockdown was fully enforced, the stations would be a major focus in screening and controlling the last remaining passengers into and out of the city.
进入武汉站周边的卡口，从至10点全部把它卡住。这边命令下达以后，民警全部无条件返岗，压力当天非常大。做好宣传，做好引导，做好警示嘛。
9点58，最后的时刻还是最后2分钟。10点钟那个就是公车现在有票的还可以走。
At 10 o'clock sharp, the entrance to the station was sealed. Flights out of Wuhan's airport were grounded, and all ferry, long-distance bus, and rail services were halted. Wuhan had pressed the pause button on travel in and out. By this time, the battle against the epidemic was underway on 2 fronts: treatment and prevention. On January the 20th, President Xi Jinping had called for resolute action to curb the spread of the epidemic. 2 days later, he had ordered Wuhan and Hubei to implement comprehensive and rigorous controls over the outflow of people. On January the 25th, at a meeting of the Politburo Standing Committee, President Xi called for a scientific and orderly approach to prevention and control, with a focus on monitoring, investigation, and early warning. While Wuhan and Hubei were identified as the main battlefields against the epidemic, other cities and provinces were urged to be vigilant. The CPC Central Committee also called for the mass mobilization and deployment of resources to support the prevention and control effort. People were told not to travel or gather in crowds.
出门尽量不要出门。
生活方面有没有需求一会打电话，好吧？好，尽量不要下楼，不要外出。好。
The compliance of over 1 billion people was immediate. Across the country, public transport services were reduced or suspended. Shopping malls were shuttered, and cinemas, scenic spots, and other entertainment venues were closed. The National Spring Festival holiday was extended, and the reopening of schools was postponed.
问一下今天体温
30.5。
The measures were stricter and more targeted in provinces and cities surrounding Hubei, and in other areas where there were large population flows. Further prevention and control mechanisms were established across the country to prevent imported cases. The defense lines were drawn up from the city to the countryside, from airports to railway stations, and from work units to communities. But still, the priority in the prevention and control effort remained Hubei and Wuhan.
首先要打好这个湖北保卫战、武汉保卫战，全国的重点在湖北，湖北的重点在武汉，武汉胜，湖北胜，全国才会有根本的胜。
Wuhan is a vital transport hub, where the total passenger flow peaks at around 15 million during the Spring Festival holiday. Closure of all transport routes out of the city would have a significant impact on limiting the spread of the epidemic.
比较主流的一些观点认为，它的传播力应该是3到4之间，这个比季节性流感、比 SARS 都要高，它就导致了指数性的爆发。那么在这种情况下，如果不采取有效的措施来控制这个武汉主要的这个疫情中心的话，就有可能会在短时间内通过人口的流动和聚集，而使疫情的蔓延。
Wuhan bore a huge responsibility in preventing the spread of the disease outside its jurisdiction. But within the city, it faced the daunting task of limiting transmission. This was the major challenge facing it, once lockdown had been imposed. By the end of January, Wuhan was being ravaged by extensive community-based transmission of the virus. Vital resources were in desperately short supply, and hospitals were struggling to cope with the overwhelming number of patients. On January the 24th, the contact information of more than 2,000 community leaders in Wuhan was posted in residents' WeChat groups. On the same day, the Wuhan COVID-19 Prevention Command Headquarters issued a notice requiring all communities to introduce comprehensive screening of anyone suffering a fever.
我的家有没有人？我里面有没有人？我就问你几个问题，屋里几个人？叫么子？你看屋里情况都还好，没得发热的吧？
Transport to hospital was arranged for anyone with a fever. Communities enforced home quarantine for those with mild symptoms who did not require hospital treatment. The capacity of Wuhan's hospitals was nowhere near what was needed. Outside assistance had been promised, but was only just starting to arrive. Community workers were under enormous pressure. Duan Bo-wen is 23 years old and had been working as a community doctor for just a month when the epidemic struck. The community was quickly identified as the front line in preventing and controlling the epidemic. Community doctors would conduct preliminary screening of fever patients and carry out nucleic acid tests on those suspected of contracting COVID-19 or who had come into close contact with the patient. However, within a few days, Duan quickly got used to being exposed to other people's saliva.
下面的医生年纪比较大的那种的，我们这边是年轻人，我们这边上年轻人来说，首先你身体什么肯定是要好一点，只要是你做这个行业有这个心。
在3楼有一个。
你把带过去，带过去。
怎么了？
可能有点憋在那个了，有点想吐。
Two of Duan's colleagues had volunteered to work at a quarantine facility. A converted hotel, the facility housed 70 suspected cases. The nurses made their rounds 3 times a day to monitor their condition. The young doctors and nurses, all in their early 20s, had never experienced hardship like it before.
刚刚从家里面出发的时候，我们都哭了的。但现在都还好，都可以坚持住。
On January the 28th, the Wuhan municipal government issued another notice requiring community workers to accompany fever patients to a community clinic or hospital. Under the citywide lockdown, private vehicles were not allowed on the streets. Only cars authorized by a community management office to take a patient to see a doctor were allowed. However, some residents complained that their communities hadn't provided a car for them, and the city's emergency vehicles were unable to cope with a large number of patients.
找到这种5吨加工店是没有，这个都是我们自己临时的，都是搭了一个。
你们又不是专业人士，这样送，你会有担心吗？
之前的时候有一点担心，但后来就接了几次以后，慢慢的也有积累了一些经验。
哎，你好，是这样的，我是3人社区居委会的。为群社区5个人，你跟居民说好没有？
你把数值给我报一下好吗？
The flood of requests for help was unrelenting, but the community workers kept working.
几乎没怎么睡，早上5点钟才睡吧。
听证了是区指挥部要求我们随时增加，随时送发上医院，我们又增加了8名。
However, the available resources were wholly inadequate, and the efforts to help those in need kept hitting a barrier. To overcome it required a more decisive approach. On February the 10th, President Xi issued a statement. In view of the situation in Hubei and Wuhan, he insisted that everyone who needed it must receive treatment, and that no one should be neglected. In Wuhan, a 3-pronged strategy was adopted aimed at eradicating transmission of the disease. First, mass screenings were conducted, in which a total of 6,326 confirmed and suspected cases were identified among 4.21 million households. Secondly, by February the 16th, new cases were being admitted to hospital within a day. And thirdly, a campaign was launched to gather accurate data on case numbers. Early one morning, an argument broke out at the Duo-1 community office on Minyi Street.
怎么了？这是又？
他要把这个违章撤掉，继续就是我们不让他撤，就骂我的工作人员。
On February the 11th, the authorities in Wuhan had issued a directive that all residential areas in the city must be sealed. Members of individual households were permitted to go out to buy essential supplies once every 3 days. Then, 3 days later, the community management and control regulations were tightened further. No one was allowed out, unless the purpose was to seek medical treatment. In response to the latest order, Tianlin had Duo-1 community enclosed with a fence. On February the 21st, community leaders received a new instruction that supermarkets and businesses were not permitted to sell directly to individuals. But how could Duowen's nearly 5,000 residents meet their daily needs? Tian Lin himself came up with the solution. He opened a small supermarket in the community office, which could stock those items that were in most demand and sell them at cost price to the residents. News that the supermarket had opened spread quickly through the community. Within 10 minutes, a long queue had formed.
只要封牌老火，也保证我们所有的物资到达。我今天才下楼，现在我下来就是这一个场面，你们看蔬菜没有，什么东西都没有。你看你心情我们都能够理解，每个人都在，我们都是万世的市民，每个人都在努力，每个人都在呼吸，不是靠哪一个人是不行的。所以说你们的后期工作也要跟我们干嘛的更好。好的，好的，好的。我们后无之忧，是不是的？我们尽力提供我们尽力保障，好不好呢？
他做的不错，我们特别真的啊！他是一般的把我们安抚的蛮好，不觉我们勤奋。
我们社区的干部对吧？我天天
现在需求我们谁我就来找他，
什么都找他，什么事情解决没吃没喝的都找他们。对啊，他们天天从过年前到现在都是在为我们那些社区的居民的工作，我们真的很感恩，很感谢，真的非常感谢你，真的辛苦了，真的不容易，真的不容易。 谢谢你，你看我们什么困难都要找你们，什么吃的喝的，没有用的都要找你们。谢谢你，谢谢啊。
People reacted stoically to the worsening hardship. Community officials could be reduced to tears by a kind word. All the grievances, all the pressure could be blown away by a simple thank you. President Xi had stressed the vital role played by communities in the prevention and control of the epidemic.
社区的工作任务是非常重的，很多地方啊，他这个工作是非常的吃劲儿的，甚至有的现在是处于一种极度的疲劳状态。一定要支持社区的工作。 要把干部啊重心下移，干部队伍要下移去支援社区。
The key role played by local officials was particularly important in some older communities. Zhengjiazui is a village within Wuhan, covering an area of 3.3 square kilometers. It is unusual for its size, and for the fact that the houses are scattered in an irregular pattern, which makes it hard to manage. Among the officials dispatched there, 14 are from the Wuhan Geomatics Institute. They use their professional expertise to produce a set of operational maps to aid the epidemic prevention and control effort in the community.
很直观的反映我们要排查的室内人员他处于什么地方，就是相当于把这个叫什么靶标定出来，然后让我们的社区工作人员有的放矢去做这方面的工作。
芹菜、胡萝卜、葱、生姜、大肠肚。
For the municipal authorities, it was vital to keep in contact with local communities. This would make it easier to maintain calm and to ensure that people's needs were met as far as possible. In all, 44,500 party members, cadres, and city government employees were embedded in 968 communities in Wuhan's 7 central urban areas to assist the community prevention and control effort. Further support was provided by 18,000 police officers and 16,000 auxiliary police personnel.
开车的时候小心慢，不要靠谱啊，注意安全。哎，好的，辛苦啊！哎。
The epidemic brought enormous pressure to bear on Wuhan. The task of transferring the sick was largely undertaken by public security officers. On one occasion, Zhao Chuang, from the Chaokou branch of the Wuhan Public Security Bureau, was tasked with picking up 2 family members of a patient, a Mr. Wen, who had been in close contact with him. Zhao Chuang and his colleague Li Binxin transferred the 2 family members to a nearby community hospital, where they underwent a throat swab examination. The 2 police officers then drove them back home. In the course of the next few days, Zhao Chuang transferred a total of 59 infected patients, 18 on the busiest day. However, he hasn't forgotten the fear he felt the first time.
第一次是3个人，我上来就坐上来了。在开车的时候，总是在后边咳，咳一声，我心里边就抖一下，因为一开始对这个还是有一些恐惧的，总觉得会到底这个隔得严不严实啊，会不会感染到我啊？
Despite his fears, Zhao Chuang continued to transport patients. He also left his phone number so that any family that might need his help could contact him.
大部分的年纪跟我爸妈都差不多大，推己及人嘛。我想着，如果说我爸妈遇到这样的情况，他向人求助，人肯定也会义不容辞的去帮他。 既然这些患者对我提出了要求，我也应该像对我自己父母一样的去帮他们解决问题。
The strongest defense lines are built bit by bit. It took time, but eventually a helping hand was extended to everyone who needed it. Xiong Fei is director of the nephrology department at the First Hospital of Wuhan and head of its dialysis center. He is also the director of the Wuhan Hemodialysis Quality Control Center. Before the outbreak of COVID-19, over 7,000 patients in Wuhan suffering from kidney failure were receiving regular dialysis at 65 specialist centers. With the onset of COVID-19, a number of hospitals were requisitioned and some dialysis facilities were closed.
他们如果不透析，那么就是生命的终结。他们很多人都流行这样一句话，就叫：如果我感染新冠，我的存活率有90%几，那么我们如果不透析，我们的存活率是0。
Worryingly, a number of those receiving dialysis were also confirmed or suspected as suffering from COVID-19. Their dialysis couldn't be interrupted to allow them to be treated for COVID-19. But if they continued to receive dialysis, they risked infecting other patients.
我们当时也是很大的一个压力。我让你在这个非感染区透析，那么我就违反了我的底线原则。 那会导致其他的人感染。我不让你透析一个活生生的生命。
Xiong Fei sent a request to the Wuhan Health Commission in late January, suggesting that a hospital should be set aside for the treatment of feverish or suspected COVID-19 patients requiring dialysis. 3 days later, Wuhan issued a notice calling for particular attention to be paid to special needs patients during the epidemic. Within 48 hours, dialysis facilities had been installed at 2 designated COVID-19 hospitals. Some 50 dialysis machines were also moved to areas of the hospitals where dialysis could be provided for non-COVID-19 patients. However, it would be impossible for 2 hospitals on their own to cope with 7,000 patients who needed dialysis.
隔离间床旁的透析，我们一直都没停。需要救命的，开始我们是6个小时一次，跟他做6个小时。后来病人多了呀，一天做6个小时做不到，做3个不得了。后来多了，做4个小时。后来病人又多了，做3个小时啊，确实没有办法的办法。这个时候如果我不跟他做，他就会死。我们跟他做3个小时，他又可以喘一口气，他又可以坚持2、3天。那么坚持几天以后，政府大量的救援都来了，这个时候我们就相当于说我们熬过了这个最艰难的这个时刻。
By March the 12th, Wuhan had managed to balance its ability to provide treatment with the demand. The city's 16 hospitals had reverted to normal operation. Its residents, during many weeks spent confined to their homes, had realized that even the simplest needs of daily urban life could only be met by strong organization, high-speed operation, and precise systems. Also essential were the countless numbers of people who were willing to take risks and stand by their posts in extraordinary times to serve the doctors and patients and the city itself. 39-year-old Mr. Ji is from Xi'an in Hubei province. He went to Wuhan in July last year to work as a delivery driver. In the wake of the citywide lockdown, Ji used his microblog account to record what he was seeing, hearing, and thinking.
我一直觉得骑手是一个低级工作，或者叫低级工作啊。但是你在工作当中，特别是武汉被封锁之后，顾客会特别客气，因为以前也会碰到有的顾客很客气，但是你能听出来那是他本身的修养，但是现在不一样了，就是他那种真诚会更多，或者说非常多，甚至于有时候是那种非常感激的那种状态。
Mr. Ji didn't have a day's rest. He met a lot of people, and some would ask him if he still made deliveries. Some asked him to buy medicine for them. These little moments made him realize how important his job was and how many people were grateful for his help.
就是我们虽然看着外卖员在街上，但是它实际上只是其中的一环。啊，你背后连接的你的背后的平台，啊，还有你的商家，这诸如此类的所有的综合因素加一块儿，外卖小哥如果正常工作，就表明其实还有背后你看不见的很多人也在正常工作。
Bus drivers, power workers, sanitation workers, delivery drivers. Wuhan in early spring was still cold, but everyone was beginning to bask in a warm glow.
有一位朋友他说我和你一样，今天也是出院14天了，我跟你隔空击个掌。我这个。
Hao Dan is a radio host at a Wuhan radio and television station. On February the 24th, after recovering from COVID-19 in hospital, he completed his 14 days quarantine at home. In a series of live broadcasts from his home during quarantine, Hao shared his personal experiences and feelings to help people understand the situation in Wuhan better and to ease their worries.
我觉得武汉挺好的，武汉是一个很好的城市。我是一个土生土长的武汉人，包括这段时间，我觉得武汉的城市运行是越来越健康了。
Someone left Hao a message. I work in customer service and was really scared after returning to work. Now I don't feel so scared following your live broadcast yesterday. Someone else wrote, I like your comments about Wuhan. Many of us are feeling relieved.
廖老师，吃几个饺子？8
个吧，也不吃太少的，不能吃太多，就是要保持身材。
Hao Dan's wife, Liao Rong, is a teacher at the primary school attached to the Central China Normal University. On January the 30th, Liao Rong was told to start recording her classes online.
我们是以区为单位来上课，就是我们上比如说我现在要上一节课是全区的学生，这一个年级的学生都要听。
今天是周一，让我们用愉快要和你一起。
Liao Rong is their class teacher, so she devotes special attention to talking to them.
虽然这个疫情确实是不好的事情，但是我觉得从一个侧面来讲，对孩子是最好的一个教育。比如说我作文的主题叫那一刻我长大了，其实我们也在逆境当中也可以成长。什么是平凡英雄，什么是逆行者，他只要有所收获，有所顿悟，这都是成长。
好久没有晒太阳了。
今天刚好也出太阳。
对，最高温度好像24度吧，我觉得
那还挺高的，
就感觉春天就是春天来了的感觉。
During the epidemic, Yang Hongbin gave up smoking, having been an addict for over 30 years.
抽烟对肺啊什么的损害也大，你看这次主要是肺什么的，反正也挺吓人。
你好，你买的药吧，您要检查一下。好，有什么事还是跟社区打电话。好，谢谢。好，拜拜，我就不送你们了。
Ning is Yang Hongbin's son. Unable to return to work due to the epidemic, he applied to be a community volunteer.
这次做社区志愿者，深深地感觉到了社区工作的那些党员干部其实也挺不容易的。好多居民因为有些问题可能没有得到及时的解决，毕竟真的人太多了，根本忙不过来，就会有一些情绪上的发泄吧。包括我们志愿者也会承担着这一部分的压力，经历过这个就学会了相互理解。
The father is delighted at how much more mature his son has become since serving as a volunteer.
家是最小国，国是千万家。一个家里生活好了，国家肯定会好。在政府在党的领导下，很快就会过去。我坚信我们国家经过这个疫情以后会更加强大。
这只要是个讨薪的噻。
Wuhan spent 76 days under lockdown. Every single resident who remained in the city, whether working in the community or staying at home, was a silent soldier. President Xi said of them, the residents of Wuhan and the people of Hubei considered the national interest and the general situation. They have proved themselves to be indomitable and resilient. They have consciously subordinated their needs to the overall interests of epidemic control and made a huge contribution. It wasn't only in Wuhan that a strong defensive position was established. From the start of the war on the epidemic, people across the country worked to establish prevention and control mechanisms. President Xi ordered that all regions should consolidate the responsibilities of local party committees and governments, strengthen the grid management of community prevention and control, and take more precise and effective steps to prevent the spread of the epidemic. Across the country, more than 4 million community workers rendered assistance to 650,000 urban and rural communities through their work in epidemic screening, publicity and education, and environmental protection. provinces, regions, and garrison commands dispatched militia to work alongside communities in site disinfection, guard duty, and materials transport. Communities and residents worked together to strengthen the lines of defense. In the early days of the crisis, guidelines were issued for protecting people and places from the epidemic. The Center for Disease Control and Prevention, in promoting the war on the epidemic, focused particularly on Wuhan. On January the 23rd, a COVID-19 prevention information video was shown for the first time in a CCTV news broadcast. Bulletins conveying essential epidemic prevention advice were also designed and broadcast on 520,000 urban digital screens in 80 cities and thousands of communities. The struggle to prevent and control the epidemic brought many changes to ordinary people's lives. Though it seemed unnatural, they refrained from such everyday actions as attending gatherings and shaking hands, and they wore face masks whenever they left home.
国家有难咱不添乱住在家里就是贡献
Loudspeakers could be heard everywhere, conveying information, discounting rumors, and boosting people's confidence in a down-to-earth populist way. Unique local methods and high technology were developed to prevent and control the epidemic.
周大爷，周大爷，不要出来，不要在外头聚集，早点回去，做好防疫措施。
A major challenge facing local governments in the prevention and control effort was to improve efficiency and ensure the availability of sufficient manpower. On February the 9th, Shenzhen introduced a system of personnel certification management featuring the Shenzhen IU Health Code app. The city became the first in China to launch a travel code mini program. On February the 22nd, Wuhan also launched its own Wuhan Fighting the Epidemic and Health Code mini programs. During the epidemic, almost everyone became familiar with using the health code. Launched across the country, it first allowed cross-provincial and then nationwide travel. On the afternoon of February the 24th, its standing committee voted to postpone the scheduled March session of the National People's Congress in order not to detract from the prevention and control of the epidemic. Earlier, the Chinese People's Political Consultative Conference had proposed that the third session of its 13th National Committee, scheduled for March the 3rd, be postponed. It was 22 years since these two key political events had not been held in spring. To alleviate the concerns of children and their parents caused by the extension of the school holiday, the Ministry of Education called on all localities to suspend classes but not suspend teaching. It also urged schools to use every means available to respond to the questions raised by the children and their parents.
在这个疫情防控期间，我们如果说把孩子们的一些学习的问题呀，把他们的一些焦虑有效的把它化解好，我们的工作做好的话呢，实际上是稳定了我们国内上亿个家庭。
作为我们教育工作者，我觉得最主要的还是给学生、给家长一份踏实。
On the last day of March, the Ministry of Education announced that the college entrance examination would take place on July the 7th and 8th. Although this was the first time in 17 years that the exam schedule had been adjusted, the news came as a relief to 10.71 million senior high school students. From the party central committee to the grassroots level, the key feature of the prevention and control work was to think like ordinary people, show concern for ordinary people, and address the difficulties faced by ordinary people. Overall, it involved constantly improving the approach and adjusting measures whenever it was necessary. There could be no vague talk about general principles. Everything had to be practical and realistic. Everything necessary had to be sacrificed for the sake of the war on the epidemic. Everything had to be focused on overcoming the difficulties. He Dehua and his wife have jobs in Zhongshan, Guangdong Province. In previous years, their company has returned to work on the 9th day of the first lunar month. But this year, the date was postponed until the 17th. The distance between their home in Luxian County in Sichuan and Zhongshan is over 1,500 kilometers. The train service is poor, so most people travel by road. However, since January the 24th, bus services have been reduced or suspended. On February the 6th, Sichuan Province announced a program for the safe and orderly return to work of migrant workers, with the authorities arranging transport. On February the 7th, He Dehua and his wife went to their local health center for a free physical exam. After having his temperature, blood pressure, and heart rate checked and receiving his health certificate, He Dehua could set his mind at rest. On the same day, the township sent a report to the Human Resources and Social Security Department. The Transportation Department could then begin allocating vehicles according to the points of departure and arrival. Long-distance transport involves drivers working in relays. One leaves the vehicle at a designated connection point to rest, and the next takes over and continues driving. However, many connection points had been closed due to epidemic prevention and control needs.
我们针对这个问题呢，我们就每个车子配备了3个驾驶员，3个驾驶员就是随车在车上休息。那么凌晨2至5点落地休息，车子停下来休息。 就考虑了集中应急的这种方式来。
Migrant workers were desperate to return to work and earn some money. Businesses were anxious to resume production in order to survive. Where economic activity is normal, people's livelihoods can be guaranteed.
想挣钱，还想健康，
那肯定卯足了劲儿，早就想上班。
从来没有休过这么长的假期，积蓄力量吧，专心的投入到工作当中。
Economic and social development is a dynamic, interactive system that cannot be interrupted for long. As the war on the epidemic progressed, it became increasingly more urgent to coordinate the epidemic prevention and control effort with economic and social development. President Xi put forward a number of requirements, emphasizing the need to coordinate prevention and control of the epidemic while restoring the normal economic and social order. The line of defense was gradually being shifted. On March the 18th, a huge zero dominated the news media. No new cases had been diagnosed in Hubei and Wuhan. However, new risks were silently emerging. COVID-19 was still spreading rapidly around the world. Beijing and several other cities as key international ports of entry were bearing the brunt of imported cases arriving from overseas. A new line of defense was needed. In Shanghai, a phrase previously unheard in reference to the epidemic prevention and control effort was being used: closed loop. It extended from Hongqiao and Pudong airports to the city's quarantine facilities. In residential homes, communities, and streets, the epidemic prevention and control measures formed a solid line of defense.
这是一张分色的主转图，不同的颜色
表示了不同的人群。橙色的就重点区域来的，黄色的就是从外地省市来的，绿色的就是没有离开过上海。我们就放在这，大家都可以。
This closed-loop approach was extended across the whole country. From mid to late March, several land ports, notably Suifenhe on China's northeastern border with Russia, faced considerable pressure due to the number of imported COVID-19 cases from abroad. In the southwest, in Guangxi-Zhuang Autonomous Region, Yunnan, and other areas, the epidemic alarm was also sounded.
你的这个室友是一个中国人还是外国人？
不用过退烧药、感冒药吗？过去14天内。
最近14天有接触过发热的病人吗？
没有。
In the middle of June, Beijing, with its huge permanent population of over 21 million, once again came under tremendous pressure from COVID-19. On June the 11th, a number of new cases were confirmed, all with a connection to a particular food market. Beijing acted immediately to lock down the affected area and through accurate tracing promptly tracked down the close contacts of those infected. Almost 200,000 people were screened in just a few days. Beijing also launched a mass nucleic acid testing program focusing on key areas, places, and groups. Within a few weeks, more than 11 million people were tested. Catering workers and street vendors, residents of medium and high-risk communities, and express delivery drivers all were tested. Instead of imposing a wide-ranging shutdown, Beijing adopted precise and targeted prevention and control measures, which eventually proved successful in stamping out the recurrence of the virus. And so, the war on the epidemic continued, with every area of the country making every effort to provide strong guarantees for the safety of people's lives and health, and for the restoration of the normal economic and social order. The society-wide prevention and control effort has been likened to a game of chess. Based on a strong line of defense, probes were initiated to explore new ways in which urban governance and urban-rural governance could advance. On April the 8th, President Xi Jinping wrote a reply to a letter from the community workers in Wuhan's East Lake New Town community. He urged them to carry on with their solid epidemic control work and make new contributions to a complete victory in the people's war against COVID-19. Across China, people of all ethnic groups have been playing an active part in the fight against the epidemic and finding various ways of building up the most rigorous prevention and control systems. That these powerful lines of defense have largely proved effective in shutting the virus out is due in no small part to the fact that they have been built and manned by ordinary people.
历史的节里手牵手，泰山昆仑冲霄汉，长江黄河江河流。